right, thank you for staying with Daybreak. We're about to get into that discussion we're talking about. We'll break it down. It's still all about COVID-19, except we'll talk about two different sectors, the health sector and the education sector, how they've been affected so far, what more can be done to this particular age. We see now Kenya National Union of Teachers is calling for a possible strike. We'll find out why and the possible way of averting that. The doctors have called for a strike already. They gave a 21-day notice. Now there's only remaining 13 days. Clinical officers have also called for a 14-day strike notice. That was yesterday, so it's at the same time it's 13 days as well. On the 6th of December is where the rubber meets the road. That is where all the strike begins. But let me introduce my guest. Dr. James Nyikal, Member of Parliament for Seme, is joining us online. He also serves at the Health Committee. Honorable Wilson Sosion is with me in studio, Secretary General, Kenya National Union of Teachers. We're still waiting for Dr. Chibanzi Mwachonda, who will be joining us online as well. He's the SecGen KMPDU. And Dr. Alfred Mutua, who's the Machakos governor, will also be here shortly. But we'd also like to hear from you the state of COVID-19. What do you think are the solutions? That's why I was telling you that we're going to talk about two different sectors, the health sector, the education sector. I see here on the front page of the Daily Nation, they're saying that the classes under trees and tents in COVID crisis. Remember, schools are supposed to reopen in January. How is that going to happen? They say learners are facing a long and dreary days when they resume classes. That's next year, with social distancing protocols making an already bad accommodation crisis even worse. But let's start with the health sector, and Dr. James Nyikal is joining me now. Dr. Nyikal, thanks for making time for us this morning. What is your assessment of the COVID-19 fight? And last time when you were serving at the Health Committee, you broke down in tears. What upset you so much?
Trevor, actually, when people ask that question, I actually get surprised and more upset. When every day we are saying so many people have died, and now our total death number is this, I don't see whether people feel that those are not numbers. Those are people with families behind, with children who will be left without anybody to care for them, people who have lost their lives. They are not just numbers. And the reaction of the country should be to indicate that they're dealing with the lives of human beings. Now we reach a position where the health workers that we take people are dying. And to many people, again, they are just numbers. Unfortunately for me, or fortunately for me, I know those health workers in person. I know Dr. Easty. We worked with him. I promoted him. I know Dr. Were Anthony. Dr. Were Anthony, together with Professor Ligeo and the late Dr. Abdallah, are the people who started dialysis program in this country. They are dying. And all those 11 or 12 doctors who have died now are consultants who are well trained over many years. I feel pain. I did. I still do. I'm surprised, just as people are surprised that I cried, that nobody is feeling that pain. That is a loss to the country. And the government reaction, I must say, has not been, it has been good, but it has not been up to par, particularly in managing the situation of doctors and other health workers, nurses, physiotherapists. Even just cleaners in hospitals are health workers too. When they are dying, they cannot get protective gear to work with. When they are dying, they cannot get the services they need. When they get the services, they cannot pay. They have to make contributions, harambes, to look after themselves. Some have died without getting the services. I know one who died in an ambulance when they were still looking for a place to take him. Trevor, let me ask you, you don't feel anything? Where are we going to take our people? I'm not crying for doctors because I know them, but I'm crying for the people who they are looking after. There are only 2,000 something consultants in this country. If they are dying at the rate of 10 per week or in 10 per month, you only need 20 months or so, and they are all gone. They have been trained for years. It is not for them, it is for the people they look after. The ratio of patient to doctor in this population to doctor in this country is about 1 in 16,000. If one doctor dies, you know that 16,000 people have now remained without health. The nurses are not that many either. And we know there's even a shortage in public health facilities. For doctors, for example, as we are saying there's a shortage, they are working around the clock. I'm being told, I don't know whether it's true, that some may now have to work even if they are positive because there's a shortage. There are 2,000 of them that are not employed.
Yeah.
This strike they are calling for, there was a bargaining strike. They bargained, they reached the solution, and it was to be implemented. It has not been implemented up to now. Yeah. And Trevor, this started as way back as 1979 when the late President Moi, when had a problem with doctors, said that even if I have to get monkeys to treat people, I will get them if the doctors cannot do what we want.
Yeah.
Even then, we even went on strike in 1981. The story is long. One day, if you have time, we can give you.
Okay.
And then you make agreement them. You don't get the agreement. They are dying. We even put in the health committee, we put money for the support of doctors.
Yeah.
To buy even masks, even for other Kenyans. Up to date, they have not been bought. Children are now going to go to school.
Yeah.
I'm in SEM, and the mask they're using. So Trevor, in short, it is a long history from 1979 up to now, the way doctors been treated by successive regimes, not just doctors, health workers in general.
Okay.
That is why I felt pain.
All right. I'll come back to you. Yes.
That nobody felt any that pain.
Okay, I'll come back to you to talk about the reaction of the government, which you say has been below par, so that you tell us what you think should be done. But let me bring in Honorable Sosion on this. Honorable Sosion, both of you are serving members of parliament. What is your assessment of this war against COVID-19? Now, how have we performed as a country?
Yeah, COVID-19 is a big test of the healthcare systems and preparedness of all governments in the world. We have seen it, and Kenya is not an exception. And I hasten to state that Kenya has been a country that has been a victim of luck, with largely a healthy population and a fairly working healthcare system. But the upsurge of COVID has proved that we are not organized in managing crisis. And this has been the biggest undoing of this country. If this country was orderly enough, in every sector, in every situation, this would be a very great country. When we sit now and we see doctors dying, the frontline men and women who are supposed to protect us dying in numbers, the nurses dying, that is reason enough for all of us to get worried. And they're coming out very honestly that all we need is personal protective equipment, PPEs, meaning the PPEs that they're receiving is inadequate. Yeah. And how many are these men and women? We don't think there are many. And if we are a country running a budget of 3.5 trillion, and we've mobilized billions of shillings for COVID, what are these billions, where are these billions targeted? If not protecting first the frontline men and women. Yeah. And the doctors have come out very clearly, lacking PPEs, and the other things that they are lacking is proper medical insurance cover. Yeah. And these are serious issues. If the doctors don't have, doctors and nurses and medics don't have a proper working medical cover, and we've seen NHIF coming out to gloriously tell the country that it is not ready to insure COVID, and we are talking of moving this country to universal health coverage. Yeah. And if NHIF is not prepared in its own infrastructure after operating for over 50 years in this country, then there is a problem in this country.
Yeah.
When we get down to community spreading,
Yeah.
at the community level, where people treat this disease casually. In fact, many Kenyans have died without knowing that they've died of COVID. And the doctors are telling us that the spreading and the numbers may not be what we are seeing. Those are just but projected figures from what has been tested.
Yeah.
As a country, we don't seem to be moving in the right direction in the management of COVID. And let me talk about the education sector.
Yeah.
We didn't see funds wired to schools for preparations of schools to implement the protocols. We've seen other economies within Africa, countries that are poorer than Kenya, the little resources that were ring-fenced and directed to learning institutions to implement the protocols were actually done. Some countries are buying masks for all the learners and buying sanitizers. And look at Rwanda.
So you think schools didn't receive any money?
Yes. No primary school received even a single cent for COVID. The secondary schools received 500 shillings per learner, and which is not adequate. And you can consult the head teachers that they've had to borrow money from other vote heads to transfer to protection, to buy masks and other necessities for PPEs. And I was saying, let's move to other countries. Talk of Rwanda, for example. During this period of closure, they've been able to put up 22,000 schools or classrooms. And here in Kenya, we cannot quantify. This is a nation where we are good at talking and building castles in the skies. But now COVID is testing us. We've been put to test. That really, as a country, we are not putting in place proper working systems that work to the interest of the people. And COVID is really indeed going to be a huge test, even now and moving forward.
We'll talk about the education sector in just a bit, but let me bring in Dr. Mwachonda Chibanzi, who's the Secretary General, KMPDU, on this. Dr. Mwachonda, we know now there are only 13 days to the day you called a strike, which is 6th of December. Has there been any progress? Have you had any sit down? Has there been any attempt to reach out to you by the government?
Thank you, Trevor, and morning once again. We've had quite some significant engagements over the past 1 week. On Monday last week, we got to sit down with the Ministry of Health, led by the CS Health. We put forth our demands and what needed to be done. Subsequently, we were in Parliament, where my senior and teacher, also Dr. Nikal, was in part of that Parliamentary Health Committee. So we've put forth all the demands. The ministry indicated that they will take initiative to ensure that they resolve the matters. So as we speak, we are beginning a new week. We anticipate that these demands shall be resolved. But if there is no significant progress come the 6th of December, then doctors shall stay away from hospitals. Trevor.
But for now, what were you told when you had the engagement?
I think the first thing was to understand the issues that are there, which we have put in the strike notice. Of course, one is the issue of comprehensive medical insurance. The second is the comprehensive group life last expense, which, as unveiled last week on Wednesday, is still not addressing all parts of our members. Remember, this one was significantly for the civil service. We still have doctors in the county governments. We still have doctors in university and teaching hospitals. So there's still some of our members who lack this medical insurance and are still exposed in COVID-19. We still need to understand and get commitment from the government on the employment of more doctors, because we do not have the adequate numbers so far. There's burnout. There's a huge shortage in the counties and across the country. Of course, the other thing is that there are certain unresolved issues that must be resolved. Doctors in Laikipia, Kenyaga must be reinstated. that the allowances that are paid to all the doctors in this country must be paid to all the doctors.
Yeah.
These are the demands that we put forth. And Trevor, the issue of PPEs, we know that there are PPEs lying in KEMSA warehouses, but even directives that they should be bought, that does not mean that we translate PPEs on the ground. So as we speak, we are yet to receive any PPEs on the ground. And so that's why I'm saying that this week and next week are crucial.
Yeah.
If all these matters are resolved, then the strike action will be averted. But if they are not resolved comprehensively and conclusively, doctors will stay home on the 6th.
But Dr. Chibanzi, are you happy with the progress so far? Because you sound to me like you were sitting down with them again to talk about same issues you've spoken about several times. You were here the last time with several pieces of a document and memoranda that you'd already served to the government. What is so different about the meeting you had on Monday?
Well, I think, Trevor, the meeting on Monday, we had not yet even issued our formal strike notice of them. We had indicated that we'll go on strike the day before, on Sunday. After we did that, the ministry called us for that meeting, and we presented our issues formally in the strike notice. What is different is that they took note, and we anticipate that they will start taking action on each of the matters. We saw the attempt of the comprehensive group life and last expense cover. I think that is something that is commendable. But even as we speak on that, as I said earlier, there are still certain areas of that and clarification that is needed, and also to expand it to make sure that you cover all the doctors who are currently working in hospitals, and also who are at risk, at the highest risk of getting COVID-19, because right now, the most riskiest of places is in the hospitals as we speak, Trevor.
Okay. Let me bring in Dr. Alfred Mutua on this. The Machakos governor has just joined us. Thanks for making time for us. Governor, why is this such a hard issue to handle from your assessment?
Well, I think it's not just an issue that is hard to handle from the counties or the national government. It's all about money, my friend. We are a poor economy. And until the time we realize that we need to grow our economy and have enough money to buy as many PPEs as Maharago, we will always have these problems. Daktari has talked about very well about the same issues they've been talking about a long time. My friend here, Sion, has talked about the problem we have in terms of logistics and planning and handling disasters. It comes down to money. We are a poor economy. We've concentrated so much on politics. We've concentrated so much on political wrangling and chest stamping than actually expanding that economic base so that we can have, you don't hear of the same PPE issues in the UK. Why? They have money. They're able to buy. Here we are struggling. We had a big meeting the other day as council was organized where we discussed this issue, especially as the doctors going on strike.
Yeah.
And now our doctors are telling us that the quality of PPEs that we are receiving, for example, there are blue ones and green ones, that they don't want the blue ones. The blue ones are not to the quality that they should be. They fog and they have issues. They prefer the green ones. Now, we are supposed to draw PPEs from KEMSA, many counties. We owe KEMSA some money. Why? Because even the money that we're getting from the national government, the disbursements have been very, very slow and have been delayed. Why? Because there's no money in the economy. The economy is poor. So it's a cycle. So when Dr. Nadia talks about KEMSA having warehouses of PPEs and they're there, maybe rats are walking over them and doctors and other people are getting infected. It's as a result that there's this problem of money.
Yeah.
Who is paying for what is coming from where, and it comes down to that.
Yeah, is it the same situation in terms of some of your peers have been unable to pay the doctors? In fact, there's always salary delays there, and they say, what is causing these delays? Is it that you don't have the money? Is it that the money is not coming from the exchequer? Is it that some of your peers are just deliberately delaying this cash?
No, I think it's, you know, nowadays it has become a joke in the county that if a county employee is paid on time, they think it's a joke. Ukipata mshahara on time, unafikiri umefutwa kazi. Umefika mapema kwa hivyo umeambiwa uenda nyumbani. Because our salaries are always delayed. I mean, we pay our county workers on the 15th, on the 10th of every month. The landlords don't want to hear that. Why? Because the disbursements are late. I mean, look at now, we are looking at, this is what? This is November. The disbursements of September are what we are talking about. And now, you know, with the law and all these auditor generals, we are not supposed to go to banks and borrow. So we have to do it kinyuma nyuma, hiding. so that we can pay our doctors, because if our doctors are on strike, and it's not only doctors are just a fraction of the healthcare workers.
Yeah.
We've got clinic officers, we've got nurses, you know, who do a tremendous amount of jobs, because doctors come, do their rounds and go. The people who are dealing with the sick patients day in, day out are actually our nurses who are there on the front line all the time. And we are not paying them on time, we are paying them late. So it's a big problem.
Okay.
This issue of insurance also
Yeah.
comes down to money. Because they talk about comprehensive insurance. So what we're looking at, what I've done in Machakos, I have given all my employees enhanced NHIF, which is more like comprehensive healthcare, so they can go to any hospital in the country and get treated. But not all counties can be able to afford this. Why? Because of lack of money. So at the end of the day, Trevor, whether we want to talk about it or not, we have a poor economy, and this economy cannot withstand shocks such as COVID-19.
Okay. Let me bring back Dr. James Nyikal on this. And Dr. Nyikal, when you started speaking to us, you said that the reaction from the government has been less than up to par. What would you have wanted to see, considering you are also in leadership position? Dr. Nyikal, I think your microphone is on mute. Kindly unmute first.
Let me start with the issue of money.
Yes.
There's a bigger problem of management than money. I had Governor Mutua say it is issue of money. If it is issue of money, why is it some county is able to buy the insurance and other counties are not able to? For example, we know that you asked Dr. Machonda there, probably about only 20 counties are able to buy some form of insurance for the health workers. The other cannot. They are all getting money from the same kitty. So that must be a management issue. The other issue, we are saying there are PPEs at KEMSA. Why are they there? Because the procurement process was not done properly and people are stuck on legal issues while the people are suffering. Is that an issue of money? When this thing started, I remember the first thing when I met the minister was that masks will be important. People are still doubting masks. And we actually put aside as a health committee 300 million for the purchase of masks that were to be given for people who cannot, who may not be able to afford. Like now, the school kids, up to now, up to last week, those masks have not been bought. So there is a big issue of management as well of the little money that there is. There is no proper system of coordination between the national government and the county government, and that's a big issue here. Now you are saying, what do I think should have been done? The little money that was there should have been done, should have been managed properly, so that the things that we require are actually made available to the people that need them. So when we are talking of green masks and red mask or yellow mask, and we are saying that the doctors don't, or the health workers, I mean the health workers don't want them, is that again an issue of money? That's again an issue of management. It means that the technical evaluation was not done properly. And I'll tell you, Trevor, there is so much to do with business in these matters also. I said the other time, business must be put aside. Improperly done business, corrupt business will kill more people than the doctors strike. So I think we have to look at that area. Even the area of implementing the guideline. When we first had, in the first wave, I think it was very effective. It may have been very high-handed by the police in some areas, but we actually saw the impact of that and the numbers went down. Okay, now this second wave, when the president kind of relaxed a bit, the guidelines that are being talked about are actually not being implemented. The only one I can say being implemented fully is the wearing of masks.
Yeah.
And even then, many people don't have masks. You go to the rural areas, funerals are going on as before. You go to weddings, weddings are going as before. You people even put them on TV with people dancing at weddings without masks. What the message are we sending? Social distancing. We said what should happen in church. It is those simple things that if we adhere to, we are going to get better. I think we have relaxed a bit. Even when the president relaxed, he didn't actually say everything now was stopped. He had clear guidelines: 200 people at funerals, 200 people in churches. Hotels were to have a number of seats, that distancing, hand washing, sanitizing. Now you go to hotels, they are actually full blast.
Yeah.
In the matatus, in the buses, in public transport, there were certain numbers of people that were to be in a vehicle, a certain number of people in a bus, even local air transport.
Yeah.
You go there, you travel. So it's the simple things. Money will come later. In my view, I'm not satisfied.
All right.
Again, when we're dealing with health workers, when they ask for straight, simple things, that should be clear. They are talking of insurance. They are talking of the allowances that they should be paid. They are talking of the services that when people die, how do they pay for them, and so on. Those are things. You had collective bargaining agreements with them years back. You haven't implemented. You are in a crisis. Are we doing well?
Okay.
If money is the problem, I know I've been a permanent secretary, and I know sometimes the exchequer release is not there. But what do we do with the exchequer release?
Okay.
The issue of health services commission.
Yeah.
In the first referendum that failed, I myself with other people, we actually had the health services in that constitutional proposal.
Okay.
When they went to Naivasha with the new constitution, it was dropped. It's a big issue with the doctors now. It is what will harmonize. It is what will coordinate the between county and national government.
Okay.
And Trevor, let me ask you, Governor Mutua is there. Is the national government capable of leaving Nairobi, going to Machakos, going to Kisumu, and saying this action is not in line with the policy, this one is not the standards that we are used to, so that we know that we have uniform standards.
Okay.
Even in the US, a very advanced country, when they have not agreed even on the policy of which state, a simple thing as wearing masks, what has happened?
Okay.
So there's a lot more that structurally we need to do, management-wise we need to do, and sincerity is also important. We do not discuss with health workers during a strike so that the strike ends, and the day they go back to work, what is agreed on is not followed on.
Okay. All right.
Health services can work in a devolved system, but we must agree that the Ministry of Health will be able to enforce standards and policies, and the county government will say those we can do. The county government implement.
Okay.
The national government set policies and standards.
All right.
If we don't do
I
those
have to
things,
take a quick break.
We are in trouble.
Okay, Dr. Nyikal, I have to take a quick break here. When you come back, Dr. Alfred Mutua will answer the question that you posed to him. Let's take that quick break, and I see some feedback coming through as well. We'll read some of them when we come back.